Hello, welcome to this NMC OSCE tutoring video. So my name is Hannah. I'm an experienced UK registered nurse, a university lecturer, and also have been a programme lead for NMC OSCE training. I am sharing my top tips, my advice, how to practice and get through these stations. So I've been asked to do a NEWS2 video, so I'm going to focus on NEWS2 today. Okay, so NEWS2, this is a really big part of your assessment station for the adult OSCE candidates. So it will come in every API except the subdural hematoma, in which case you will have the GCS monitoring chart and the observation chart with that. But for all the other API scenarios, you're going to have to do and complete the NEWS2. And it's a really, really frequent area of fail as well for nurses taking their exam because they just make errors on the chart and then don't understand the NEWS2 and the escalation policy and verbalisation that goes with that. So NEWS2 stands for National Early Warning System, and it's the second version that has come out. And it is a system for recording and scoring the physiological observations of a person, okay? And it was designed by the Royal College of Physicians, and its purpose really was to identify those acutely deteriorating patients. Initially it started off in the wards and hospital areas, but now NEWS2 is used throughout areas such as the community and the ambulance service. And it was designed to pick up those patients early to prevent them from becoming, acutely unwell or going into a peri-arrest and arrest situation. And it is used throughout the NHS and UK healthcare. So it's not just a skill for your NMC OSCE, it's a really essential area of practice when you go on to get your nursing jobs in the UK as well. And you can go to the Royal College of Physicians, and I'm just going to show you their website because it has a bit more information, but it also has all the download charts which you can download separately to use and support your practice. Okay, so if you type into Google or your internet search engine Royal College of Physicians NEWS2, it will take you to their page here. So this is all open access and free for you. And it gives you a little bit more detailed information about how the NEWS2 works. But what is really useful is you can download separate files for the scoring system, the observation chart and the thresholds. Now that is in the NMC supporting OSCE documents, but it's embedded within that great big file of about 80 pages, isn't it? So if you just want to print off the individual charts to practice, then I would come to this site and do that here, okay? Okay, so going back to the NEWS2 and how it works then. So it's a simple scoring system and it gives a score to each of your 6 physiological observations. So your respiratory rate, your oxygen saturations, your systolic blood pressure, okay, only scores for the systolic, the top blood pressure, okay, that's the most important number. So driving cardiac output from the heart, okay, and the perfusion of the organs, heart rate, conscious level and temperature. And so each vital sign is given a score of 0, 1, 2, or 3. Okay, so the further your observation is away from those normal parameters, the higher the score it will get. This is a really useful tool to familiarise yourselves with the scoring system. So you'll see where our observations are within a normal parameter, which is the white column in the middle here. You get a 0 score, okay? So a normal respiratory rate is 12 to 20. So that would, if my respiratory rate was between 12 and 20, it would score a 0, okay? If my respiratory rate was between 21 and 24, it would score 2. And if it was greater than 25, it would score a 3, okay? And this is quite a good chart to use to help you with your charting on the NEWS2 chart as well. And again, it's available from the Royal College of Physicians. It's not within the NMC supporting document pack. Because you can see, if your respiratory rate was 21, then you should be charting within that orange box and not in the yellow box, okay? So it can help you practice your charting as well, okay? And you'll see, the further your observations deviate from normal, whether that's an increase or significant decrease, the scoring increases. And then once you've taken your observations, you've given each score to each observation, you then add them all up together and that gives you your overall score, okay, your aggregate score. And depending on that score then determines how at risk that patient is, okay? So a low score between 0 and 4, they're at relatively low clinical risk and you would manage them on the ward, okay? If they score 3 in a single parameter, okay, so if my respiratory rate alone was scoring a 3, then this is a red flag, okay, so they are at medium risk and you want some urgent referral, okay, and if the score is between 5 and 6, they are again at medium risk and you want some urgent response as well and medical review. And a score over 7, this patient is very, very unwell, okay, this is very high clinical risk. And they need to be in a high dependency or critical care area normally with continuous monitoring. And you need an emergency kind of medical response to that patient. So the higher the score, the more unwell your patient is and the more at risk they are of significantly deteriorating. So in terms of your NMC OSCE, you will need to document your assessment station observations onto the NEWS2 correctly, okay? You'll need to add up the score correctly. You'll need to verbalise the score and the escalation and the frequency of your monitoring correctly, following the policy, okay? And this is an absolutely essential assessed part of the assessment station in your API, okay? It can be an area of a lot of errors, okay? And any errors with this is a critical fail and you will fail the station. So I'm going to talk through documentation, okay? So that's the single biggest bit which causes errors in the NMC OSCE, okay? So the NEWS2 observation chart will be presented within your information for that assessment station, okay? Normally the patient details at the top are filled in, so name, date of birth, hospital number, but just double check this, okay? And then the next section is you must add the date and time of your scenario in your station, okay? So I've highlighted this in yellow here, okay? This often gets forgotten, okay? And it is a critical fail if you don't do that, okay? Because legally we don't then know when those observations have been taken, okay? So write your date, which will be your test centre date, okay? And on your scenario briefing, you'll have a time. You might say, no, the date is today and the time is 0800. So you'd put 0800 into that box, okay? So that is really, really key part not to forget. And then we're going to go on to documenting the observations. So the great thing about the NEWS2 chart is it is laid out in that A to E approach, okay? So again, if you're feeling really nervous and not quite sure where to start with your A to E assessment, have a look at your NEWS2 chart, okay? It says it's got A and B, so I'm going to assess my airway, okay? Make sure it's clear, and then I'm going to move on to B, my respirations, and that's the first vital sign we're going to be taking, okay? So when you're doing any form of documentation on the NEWS2 chart, you want to document it with a dot, okay? Now, if you're working in clinical practice as a healthcare assistant or in other areas, you might see lots of different practice around the NEWS2 chart, which is incorrect, okay? It's designed so it can be really easily and clearly picked up from the end of bed and you can see the trend in the patient's condition. So you don't write the observation on it, okay? You don't write the number, you must mark it as a dot, okay? So I've put 2 different respiratory rates on this document here. So one, I've put the respiratory rate as 26, okay? So that's the first column. So that is going to be above my 25 line, okay? And that would score a 3 because it's in the red box. The second respiratory rate is 20. So that is going to be just right at the top of that box, okay? Not over that box because over that box is 21. And we'll make that a score of 2, okay? And remember that 20 is normal respiratory rate and we score a 0, okay? So be practice and being familiarised with yourself with the scale, okay? So the bottom line is always the bottom number, okay? And then the top line is always the top number. And then going to go on to recording the oxygen saturations. You need to be really careful in your OSCE because there are 2 oxygen saturation scales with the NEWS2 chart. The scale 1, which we use for most of the population and which you will be using for your NMC OSCE, okay? So you'll see scale 1 at the top here, SpO2 scale 1, okay? And underneath it is scale 2, and that is only for patients who have known hypercapnic respiratory failure and have been prescribed a lower oxygen saturation threshold, okay? And that's always completed by the doctor or the medical team, okay? So what you need to be really careful of is when in your OSCE that you are documenting your observations in scale 1, so in the top box, okay? because it will be a fail if you document them in scale 2, okay? But also the scoring is very different and it will impact your overall News2 score, okay? So I've done 2 saturations here. The first one, the first column, saturations are 96. That goes in the white box, score 0. And the second one, I've documented some saturations of 92. Okay, that goes into the orange box there and scores a 2. Then the next section on the News2 chart will be documenting air and oxygen. Okay, most or pretty much all of your API scenarios, your patient actor won't be on oxygen, just be on air. So you need to write an A in the box. Okay, so you can see I've done that in the first column there. A equals air, and it tells you on the side here the code. Okay, that's the only time you're writing a letter and not a dot on your News2 observation chart. Okay, if your patient was on oxygen, you need to write the litres of oxygen. So say, for example, in the second example, I've put 15 litres, and the device, so the mask or what they're receiving that oxygen through. Okay, so for example, reservoir mask RM. And any patient that's receiving oxygen, again, that's not normal, not physiologically normal, we would score that a 2. Okay, in terms of your OSCE, normally your patient actors are just on air, so you just need to write A for air. Okay, moving on again with our systematic approach. The next section is blood pressure. Okay, so blood pressure, we normally do V and then an upside down V and then a dashed line down the bottom. Okay, and the point of that V is going to sit where your blood pressure reading is. Okay, so for example, in this one, I've got blood pressure of 102. So that will sit just above my 101 line. Okay, that's my systolic, and my diastolic is 70. So that's going to sit just on that line, that 70 line. Okay, above that line would just be 71. Okay, you need to be really careful with your plotting of your blood pressure. Okay, make sure you understand the divisions within the box. Okay, so each box is 9. Okay, so if my blood pressure was 105, then that systolic would sit just in the middle of that yellow box between 101 and 110. Okay, now the top number, like I said before, the systolic number is the only one that scores. Okay, so for this one, my score is 1. My diastolic, that bottom number, will always be in the red, but we don't score that. Okay, that is not a concern. The concern is always that systolic, that top number, which is your driving pressure out of your heart and your driving pressure to your organs for perfusion. Okay, so remember, only score the systolic number at the top. Okay. Then I'm moving on with my pulse. Again, you see this nice structured A-to-E approach that the News2 chart has, which can help you as well in your OSCE. So again, a pulse is a dot in the box. Okay, no numbers, you don't need to write anything else on there. So for example, my first pulse, I've done a pulse of 95. That's right in the middle of that 91 to 100 box, and that would score 1. My second pulse is 72. So just on the lower half of that box between 71 and 75, and that's normal, isn't it? So that would score a 0. Okay. Then we're on to conscious level. Again, a dot in the box. Okay, don't write a letter. If your patient is alert, so you know in the assessment station we need to check their alert to time, place, and person, then we would put a dot in the box, which is white, which is a score of 0. Now you notice with the conscious level, there's no 1, 2, 3. Just if the patient is not alert, if they are got a new onset of confusion, they're only responding to voice or pain or unresponsive, then they automatically score a 3. Okay, and that's because that's a really high red flag that that patient is unwell. Okay, the key thing to remember with conscious level is it's a new onset of confusion. Okay, so sometimes maybe in my Alzheimer's scenario, I want to be assessing if that level of confusion is the normal for that patient, or if it is changed, got worse, okay, or is a new type of confusion for them. Okay, if when I'm assessing my Alzheimer's patient, they can't remember the date, and I say to them, you know, is that normal for you? And they say yes, then I mark them as alert and I verbalise that to the examiner. If, for example, they're very confused and that's not normal for them, then you would mark them as a confusion, okay, because that is a new or changed level of confusion for them, okay. So that is quite important, and an important point for practice as well, okay. So we need to know what their baseline confusion level is, okay, and whether they're presenting with a new onset of confusion. And now we're on to E for exposure, so temperature. So again, a dot in the box, okay? So I've done 2 temperatures here. The first one is 37.5, so that would be just in that middle of that box between 37.1 and 38. And that would be score 0, because that's a normal temperature, isn't it? And then I've got a temperature of 38.5, so in between 38.1 and 39, and that would score 1 on the box there, okay? Again, a dot, don't write any numbers down. Where you do want to be writing down your actual numbers from your observations is on your assessment paperwork that you will get, okay? Because you'll need that information for your handover, okay? So you've got to be really careful when you're documenting, and you are documenting what you have verbalised to the examiner, because they will check that. And if you verbalise a respiratory rate of 18, but you document a respiratory rate of 22, that is another critical fail, okay? So you've got to be really careful with your documentation. I know time is tight, but try not to rush it, okay? And be really, really careful with it. Once you've completed your observations, you then need to add up each scoring for each observation, and you come up with your total NEWS2 score, which you must put in the bottom here. It says NEWS total. Absolutely essential, put the NEWS total in there, okay? And then you need to document your monitoring frequency based on that score, whether you are going to escalate care or not, with a Y for yes or an N for no, and your initials, your first letter of your first name and the last letter of your surname. Okay, so how do we know what monitoring frequency we need to do based on our NEWS2 score? So you will be presented with the clinical response thresholds and triggering, okay? So you will have this in your OSCE, okay? So if your total score is 0, so all your observations are within normal parameters, your monitoring frequency is 12 hourly, so you'd write 12 hourly, and you wouldn't be escalating that to anybody, so you just continue routine monitoring, okay? If my score was between 1 and 4, then I'd be doing my monitoring 4 to 6 hourly. So you'd write 4 to 6 HR in the box, okay? Now, as a registered nurse, you don't need to escalate, but I normally tell my international nurses to say that you would just go and confirm this with the senior nurse, okay? Remember, you're kind of not new nurses in that sense, but you're new to working within the UK healthcare system, okay? So there's nothing wrong with saying actually you put a yes and escalate, and that you would go and inform the senior nurse. That's quite safe, okay? You wouldn't be referred for that, okay? Alternatively, you can be happy as the registered nurse to say that you would, you don't need to escalate that to anybody, but you're going to come back and check in 4 to 6 hours, okay? Now this next section, a 3 in a single parameter, can be quite a frequent area of failure, okay? So if it's a 3, so there's a 3 in one observation, so like I said, that respiratory rate is scoring a 3, the conscious level scoring just a 3, the pulse is scoring just a 3, then they are for hourly monitoring, okay? And that is different to if I get a 3 made up of 3 different observations. I hope that makes sense, okay? So if I've got a 3 because I've scored 1 on my rest rate, 1 on my pulse, 1 on my temperature, that puts me in the 4 to 6 hourly monitoring still, okay? But if I'm scoring a 3 in one observation, so my respiratory rate alone is scoring a 3, then I'm on to hourly monitoring, and I must escalate the medical team, okay, for them to come and review. So that can catch nurses out sometimes. So be really clear, you know, if your 3 is being made up of different observations, all scoring lower points, 1 to 2, or if it's being made up of one observation scoring a 3 in itself. If your NEWS2 score is 5 or more, then you are again going to do hourly monitoring in that monitoring box, and you're going to escalate to the senior nurse and to the medical team for an urgent assessment, okay? And if you're scoring 7 or more, you are going to do continuous monitoring. So you put a little C in the box, okay? And again, you're going to inform the senior nurse, you're going to put out a medical emergency call, okay? And you're going to consider transfer to a high dependency critical care area, okay? Now, your patient actors are very, very good in the OSCE, so don't assume that you're going to have a low scoring NEWS, okay? You can have a high scoring NEWS on an OSCE actor, okay? So be really familiar with the trigger thresholds and the frequency of monitoring and your escalation approach. But this will you will have this piece of paperwork in your assessment pack, okay? You don't need to memorize it, but remember to use it, okay? Now, you might have your assessment station based in the community, okay? Now, there is a different community news2 chart, but the NMC don't use it for some reason. So you'll have that hospital-based chart, okay? So the same thing applies. Document your observations, add up your score, verbalise your score, okay? Now, if your score is 0 and you're in the community, you'd still document 12 hourly and just say you come back and do that on your next district nurse or community nursing visit, okay? If they are scoring between 1 and 4, again, you put the monitoring as per the ward-based chart, which you will have, so 4 to 6 hourly. But you're going to ring and speak to the GP and you're going to get them reviewed today, okay? If they're scoring 3 in a single parameter, they need hourly monitoring and you need to ring an ambulance, okay, and stay with them until they are transferred to hospital, okay? These patients are unwell and need to be transferred to a hospital. And again, if your score is 5 or above, hourly monitoring and you need to get an ambulance, okay, and they need to go to hospital. So you need to learn some verbalization if you are in a community setting for your API, which can and does happen, okay, but you will have the same hospital-based chart and clinical response chart as well, okay, so it can be a little bit confusing. Okay, so if you make any errors whilst documenting your observations, you need to put a vertical line down the whole observation column and replot all your observations again in the next column, okay? Don't just cross out that observation and replot it, okay? You've got to do the whole column. Sign and date over the top of that vertical line, okay? And replot your observations in the next column, okay? You don't have a lot of time, so just try and be really careful to do it first time, okay? But if you do make an error, that's what you need to do, and that's a really important part as well. Otherwise, it's a critical fail. So what are my top tips? My top tips are be really, really familiar with the chart, okay? So either print off a copy from the NMC supporting documents or go to the Royal College of Physicians and print off a separate chart, okay? Understand the numerical divisions in each box so you understand the scaling and where you're going to need to put your observations. Just practice charting different observations. If you've got a friend or family member, just get them to write down, loads of random observations for you to document, okay? Take your time, okay? And I know you feel rushed. I would always advise to do your key principles, your A2 assessment, your NEWS2 documentation and get that done and secure, and then move on to your holistic assessment, okay? And like at any station, if any time left over, just go back and check that NEWS2 documentation, okay? Ensure the observations you have charted are the same as what you have verbalized, okay? That's really important. Don't forget to add the date and the time at the top of the chart, okay? Especially if you make an error and you're replotting your observations, you need to put the date and the time in the top of that column again, okay? Make sure you add up the NEWS2 correctly. It's only simple maths, but when we're nervous, we can add things up wrong, okay? Make sure you add and verbalise your monitoring of frequency, your escalation, yes or no, and your initials. I can do some small group tutoring. I can, if you're practicing at home by yourselves, I can listen to this online and give you lots of one-to-one feedback, absolutely crucial for you in passing your OSCE. Do really flexible sessions that fit around you so you're not confined to fixed training dates and centres. You don't have to take time off work. You can work around evenings, weekends, and fit around your working commitments. And we get access to all my teaching resources, all my OSCE teaching resources from my OSCE programme. Can also do mock OSCEs online and face-to-face as well. So you can email me, hannah.lames@outlook.com, or visit my Facebook page, Nurse Tutor Tutoring with Hannah, or my Instagram page as well, Nurse Tutor with Hannah. Like and subscribe. If there's any videos that you desperately want, pop them in the comments and I'll look to do those first.